this is what we called abscopal effect. It means the action of a local therapy upon distant out-of-field foci of tumors. It is very well known in the series of patients treated with ocular melanoma with the X-ray. And this is a sort of activation of CD8, and they will be activated, they will affect a secondary abscopal tumor effect distant from the primary tumor. There's a relationship between the thermal ablation and immune response, very well known if you look at in the literature. However, cryoablation seems to be the better form of thermal treatment for promote the immune response. Seems to be better than radiofrequency ablation microwave because there's no coagulation. And any form of hyperthermia may cause protein denaturation by reducing the number of intact antigens. And the heat may cause tissue coagulation, reducing the amount of intracellular contents that spill outside the tumor into the bloodstream, activating the immune system. That's the reason why the hyperthermia-based method seems to be less prone to promote the immune response. This is totally different if we think about the mechanical HIFU, the so-called cavitation effect, because it breaks the tissue, cells and proteins in small heterogeneous fragmented molecules that potentially activate the immune response in the same way it happens with cryo. This is another example of an abscopal effect. This is a 75 years old male with anaplastic undifferentiated pancreatic cancer stage 4 for a distant lymph node metastasis. March 2014, the patient had the first line of standard chemotherapy at that time. In June 2014, as you can see, the tumor was much bigger, so the patient had the second line with FOLFIRI regimen. This is June 2014. Unfortunately, it was not effective, and the patient had a bigger lesion in September. This is a CT scan the day after HIFU. You can see how the tumor is completely dark because it is liquefied. At that time, the patient had retroperitoneal lymph node metastatic disease. The patient didn't have any other chemotherapy since January 2015, but not only the primary tumor stopped to grow and was even smaller during the time, but also the distant metastatic disease completely disappeared. And this is the CT scan February 2018, 4 years later, in a patient with pancreatic cancer in stage 4. Our experience up to 2016 is 72 patients with pancreatic cancer. Majority of them were adenocarcinoma on the head. Patient had even metastatic disease in some situations. And 23 patients from the 72 had the stage 4. And all patients were non-amenable to be resected. This is another experience with pancreatic neuroendocrine tumor, a huge lesion here with some calcification behind the tumor. And this is the day after the treatment. It is completely dark. It is not perfused. And this one here, and 4 years later, completely treated. Our results. We had 100% of technical success. Just one complication in our series was at the beginning. It happened in a patient who had a narrowed portal vein due to the primary tumor was affecting the portal vein blood flow, and due to the edema caused by the treatment, the tumor completely occluded the portal vein. We had a objective response in 64% of our patients, with disease control in around 90% of patients. In 4 patients, we had the so-called abscopal effect with the shrinkage of distant tumors. In conclusion, HIFU for pancreatic cancer seems to be safe and feasible. It is both very useful for debulking and palliative purposes. Data coming for our pancreatic series and even from the literature are very promising for upgrading HIFU as a clinical option therapy in this field. The abscopal effect can be achieved by using high-intensity focal ultrasound in pancreatic cancer patients, and immunocheckpoints activation requires fragmenting proteins, not coagulated, so it means that we need to go in the direction of mechanical ablation, that means cavitation rather than thermal ablation. Of course, more data about the immunological reactions after HIFU should be collected in a possible dedicated registry. In the series of liver, we may conclude that the HIFU represents an active option for local treatment and oncology. This is because it is not invasive. It is still an hard challenge compare HIFU intensive focal ultrasound with the minimal invasive options such as frequency ablation, microwave, mainly for liver tumors, because the easiness of using these devices rather than using at this stage high intensity focal ultrasound devices. However, there's an elective indication in using this non-invasive approach in patients with coagulative disorders. HIFU is still at the, I may say, infancy age, but the new developments are leading for the next generation devices. And now I would like just to show you what is changing in the field of technology in HIFU. This is the machine, the ultrasound guided machine that we've been using for 10 years. Then many different improvement of the technology leads for portable machines that were not very efficacy for large abdominal tumors, until the newborn volumetric portable device. They are both available in my hospital. This is the Mirabilis device with a high-speed treatment system. They may cause a volume treatment with a high energy control that may give a much faster results. The precision robotic delivery system may reduce the burden of physicians, so it means the machine will automatically define the volume to be treated without any interference from the users. It is very easy to use and it is highly repeatable. And this is one of the patients of the pilot study we are doing with the new machines in my hospital. The machine has been installed in mid-January this year. She is a patient with 2 previous myomectomies, but she is still bleeding with pelvic pain. This is the movie regarding this patient. This is my hospital, where we mainly are involved in cancer field, but we have also a big experience into the patient with uterine fibroids. As you can see, we can image the patient before by using ultrasound contrast media just to look at the amount of vascularization. You can see the contrast media go inside the fibroid from outside within the center. Then we use water just to couple the head, the transducer with the skin of the patient. The patient is completely awake. You can see by using ultrasound the target. Then there's a 2-view ultrasound imaging screen, so you have the axial view and the sagittal view during the treatment, so you can look at what happened during the treatment in a real-time way. In this patient, we use 2 runs of 2.5 minutes, so the total amount is 5 minutes. You can see the tumor, the fibroid is completely hypoechoic. After 5 minutes of treatment, it is a 6.8 centimeter fibroid, and this is the ultrasound performed immediately after. You can see all the fibroids is hyperechoic, and then we inject the contrast media, and as you can see here, there's no enhancement within the tumor, within the fibroid. And the white spots are just the boiling cavitation appear after the treatment. Thank you for your attention.